Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today's guest is someone who has spent her career asking a question that sounds simple, but is actually radical. What if we expanded our definition of health to include life? Alexandra Drane is the co-founder and CEO of Archangels, a national movement dedicated to supporting the more than 40% of adults in this country serving as unpaid caregivers. And she brings serious proof of concept to that mission. She previously co-founded Eliza Corporation, a healthcare engagement platform built on data and behavioral science, bootstrapped it, and successfully exited in 2017, then turned around and asked, who is the system still leaving out? The answer was caregivers, and she's been shamelessly hustling for them ever since. Alexandra, welcome to Nurse Rosa's Insights.
Thank you. Thank you. I'm so excited to be here because, I love what you're doing, how you're doing it. My personal obsession with any progression for any organization is that they don't leave until the problem is solved. And Rosa, you and I both know this problem is not solved. The problem both of the unmentionables, nor the problem of, not problem, let me restate that, the massive, beautiful, extraordinary opportunity to care for unpaid caregivers.
And I'm so thankful for your not just advocacy, but your building of a solution and kind of an aggregator of solutions. So do you want to tell us what Archangels is that you're working on now at this point to start with? And then we can go more into your backstory.
So one of the things that I was doing my crawling around on you, my prep around you, I wrote a couple things down, like one, nurses rock. I love the extent to which you get that. The work you have done around stroke in particular, wildly important, as you know, better than anyone. But I think my number one true love source for you is your obsession with actionable solutions. And I feel as though often in the world, we spend a lot of time admiring a problem. And I'm a huge, right? Like, oh, let's talk about that problem some more. Wait, what about this part of that problem? Oh my gosh, I know an even bigger part of it. I have an idea. What if we took all of our energy and we focused on creating sustainable, scalable solutions to solve those problems? Because if we did, each of those things are massive, massive opportunities to do well by doing good. So Archangels, I will not tell you the whole way we got there. What I will tell you is as a bootstrapped organization, we have to do what is resonating with humans and what people will engage with and respond to, and ultimately we can get paid for. So we are a public benefit corporation. We are not here to make all the money. We're just here to make sure that we can make enough money to continue to invest that money and continue to reach more unpaid caregivers. So what we focus on is the over 40% of adults who right now across the nation are serving as unpaid caregivers. They are taking care of a family member, a friend, a neighbor, you name it. They often have zero idea that they're in this role. And we talk about finding and engaging them using unorthodox, visuals and language because this population is not focused on themselves. They're not caregivers, they're caregivers. They're always looking outwards to what they can do for other people. And often their own health takes a hit in the meantime. And they're not even aware they're in this role. And because they're not aware they're in this role, they're not availing themselves of the resources that do exist to support them right now. Are those resources perfect? No, but they are a start, right? There might be stuff buried within their employer and benefit design as part of an employee assistance program, mental health support, financial advice, legal counseling, whatever it might be. We know that health plans and health systems have put together a bunch of resources. Maybe they're not labeling it, this is for the caregiver, but the resources they put together that are available for free for anybody, they do help unpaid caregivers in particular. And then the last is, of course, the work that's done through communities and states and the fact that someone could access your podcast, for example, to be free. So we use shameless hustling to find this population that has no idea they're in this role. We help them get their intensity score. That serves as an aha moment for them. About 80% of people will go from, I'm not a caregiver, I'm just a son, daughter, God-fearing person who helps just because, to, oh my gosh, this is me. And this is deeply intense. And in that moment, we then match them to all these resources that exist. And then all that kicks off data for the individual and language. So I can go and say to my partner, oh my gosh, this is why I'm in the red. This is why I'm behaving the way that I am. Or go to my employer and say, can you support me so I can get into the clear? And then it also is data that we can use to pull together to deliver back to an employer to say in a de-identified, anonymized way, this is a population that you can and should be caring for because it's top and bottom line opportunity for you. And we can do that same thing for, you name it, communities, states, any interested entity who's interested in, I have an idea, sucking less for the over 40% of adults across the nation right now who are doing those beautiful work possible, and often they're invisible.
So true. And I love that you're using essentially like a quiz because I mean, that's kind of how companies like BuzzFeed got big. It's like all these quizzes. It's like, what fruit are you? Right? People will fill out a quiz all day long. So that angle is absolutely brilliant to just get people. So what kind of things does it pop up like to say like, am I a caregiver? Or what is it that they're clicking on to take that quiz to get that score?
Well, so there's a couple, there's no end of ways that we find folks. So we'll push it out through social media. We'll push it out like an employer will send out emails, or they might have a webinar where we'll come and speak, or uh, there might be, digital billboards that will have different hooks to get people to pick their head up for a second. I'll
Mhm.
share a couple of them with you right now because they're so fun to think about. Often
Mhm.
when people think about caregivers, what they're thinking about in their head is someone who looks like me, right? I'm 54 years old, and they're thinking about, the fact that I'm caring for my mom. And so
Mhm.
the visual that they will have as they're trying to find this unpaid caregiver and love on them appropriately, thank you for that, is, let's say, a little old lady, right? Sitting in a chair like this, and that little lady's looking up. Presumably, she's my mom. And then they have me, right? The 54-year-old lady, and my arm is on her shoulder, and I'm looking down on her like this, and she's looking
Mhm.
up at me. And that's perfect and gorgeous. And for the 20% of people who respond to that, that's awesome. What we have learned over time is that for many people, that's not what caregiving looks like. It is the absolute fit you're having with a teenager who has not been telling you the truth about things that are going on. It's a very hard conversation with someone who has a substance use disorder, and you are their primary caregiver, and the hypervigilance you've been feeling, worrying that something was wrong. It could be what you're doing to support a friend who's going through menopause and caring for, we all know if you're going through menopause, which by the way, as a 54-year-old, when I was growing up, I thought menopause was like you turned 50 and bam, you went through menopause. Like, who knew? It's a 15-year process with 2 to 4x the mental health impact and all these other joyful things like sweats and joint aches. And guess what? Right ass women are in this age, they're also likely to be sandwich generation. When we
Yes.
are sandwich generation, it's the most intense time. So we might use a hook around, menopause. Is it
Mm.
menopause, caregiver intensity, or both? Get your score. 40 to 50% of caregivers are men. They
That's
often
what
don't
I was
realize
about
it.
to ask you, like, were you
Yes, let's
surprised
talk
at
about
the
this.
percentage of caregivers who are men?
Yeah, 40 to 50% of caregivers are men, and they are the least likely to see themselves in this role. And the reality is, as you and I both know, the data supports women are often shouldering way more of the intensity that comes with caregiving. They're doing more tasks, they're spending more hours. But what intensity is measuring, we do not measure caregiver burden. We very intentionally talk about intensity. Because
Mm.
intensity allows you to hold all these things at the same time, right? Like when I'm caring for somebody, I have moments where the love I feel for them is it's like it pushes outside my body. But then I also might have a moment in the next second where I'm digging my fingernails into my thighs, like, oh, I'm so frustrated. I'm smiling, but I'm doing that to keep myself, right? That's intensity
Mm.
of frustration. You have intensity of joy, of agony, of effort, of exhaustion. And so intensity allows you to hold the ginormity of what it is to be an unpaid caregiver, the largeness of the feelings that are associated with it in one word. And it's strength based. Being intense is actually a good thing. We got to learn how to process it. So we'll be measuring somebody's intensity as we're going through the process, helping them to match to what these resources are. And by using the word intensity, and by using the term archangel, which is also beautiful, you're a warrior angel spreading your wings out over these people that you're caring for, we'll end up getting a lot more attention than a more traditional use of language and imagery might.
Yeah, and so how did you come to be so passionate about taking care of caregivers? Like, as I was reading up on you some more, it looks like you worked in an area that would have given you some perspective into like palliative care and end of life needs and things like that. Is that something that you were professionally exposed to before you were encountering that in your own life?
It was a confluence of a couple of things. I love the word confluence. I'm not sure I'm using it correctly, but I'm going to use it anyway. It was like
Okay.
all these things meshing up together.
Yeah.
So I am a super data geek. So oftentimes people will say, "Oh, I started this company because I had this personal experience." Archangels is my sixth company, and I've never started a company out of personal experience. It has always been for two reasons. One, overwhelming demonstration that the data supports that this is something that can be addressed in a sustainable and scalable way. And then number two, the more we're digging into that, the more I can't not do it. Like real entrepreneurs cannot not start this thing. It like comes out of them, right? It's like I am with company like a woman is with child. Like it's just going to
Yeah.
happen. It's too bad. So there are a couple things that came together. One is my company before Archangels was called Eliza. And it
Mhm.
was at Eliza that we, in a very data driven way, stumbled ultimately quite intentionally upon this notion that we have to expand the definition of health to include life because when life goes wrong, health goes wrong. And we made the data driven argument that caregiver stress, financial stress, relationship stress, and workplace stress are actually the biggest diseases in the US. And the way that we came around to that is we had a patent on over the telephone speech recognition being used in an outbound way. So we were paid by health systems or employers or PBMs or pharmacies to call out to the 80% of people who are not calling into the healthcare system. They're not coming in to take care of themselves, to remind them to do things like get their mammogram, get their colon cancer screening, take care of their diabetes. And when we get that person on the phone and say, hey, it's time for your mammogram, do you plan to get it? Or time for a colon cancer screening. Are you ready to get it? Are you planning to get it? When someone said no, we'd say, well, why not? And the literature would suggest, and what people thought was it would be for these reasons 1 through 4. What we learned ultimately is if we ask the open-ended question, okay, well, why aren't you going to get your mammogram? Why aren't you going to get insert whatever? We would hear people say so beautifully and with such humanity, gosh, I'd love to get my mammogram, but I can't because my mother with Alzheimer's just moved in. But I can't because my father had a stroke and now
Mm.
I'm providing round the clock care. I can't because, right? And it was always these life reasons that were keeping people from being able to do the things for themselves that you would think would be obvious that they should be doing and they have the time and they should do it. But they're not because they have this whole other set of things that they're dealing with. So that's why the Unmentionables focused on those 4 conditions. In parallel, my sister-in-law was diagnosed, my beautiful sister-in-law, was diagnosed with glioblastoma, which
Mm.
is a very, very, very hard form of brain cancer.
Yeah.
She was diagnosed the night I got hitched to her brother. For context, she had a 2.5-year-old little daughter named Alessia.
Oh.
Alessia is now 24 and crushing it at life. She's like our oldest daughter is how I feel about her, how we feel about her. She's got her dad and bonus mom also, but this girl is surrounded by love. But her mom died 7 months later in a textbook case of overtreatment. And it was in that experience that I personally got to see the heartbreak of when palliative care is not involved, when hospice does not get involved. And it's also understandable. Anytime I feel strongly about something, I understand the system has a very hard time letting a 32-year-old woman in the prime of her life go with a 2.5-year-old. I get that. In my family, we were very comfortable talking about end of life and the equivalent of how do you live your best days to your last. We knew my grandmother wanted to die in bed. She did. We were all with her. We knew her daughter, my mom's sister, my aunt, missed a diagnosis because she was caring for my grandmother. She
Oh.
passed 2 months after my grandmother passed. She wanted to be in the hospital. She was surrounded by family. So we were all very comfortable with how do you have that conversation so you can guide somebody through in the way that a hospice or palliative care situation would. My
Mhm.
man is Sicilian. And in Sicily, you don't have those. At least his family was not comfortable with those conversations. His father was diagnosed with colon cancer when he was 16. They never talked to him about the fact that he had cancer or what he would want to do. My sister-in-law, my man didn't want me to say out loud to him the reality of glioblastoma and what it was going to mean for 4 of the 7 months. I never spoke with Za about it directly. So we weren't able to capture like the videos or the notes or the letters or the things for Alessia that we would have wanted to. I will just say for anyone else who's been in that same scenario and is beating themselves up about it, as time has gone on and you continue to unpack and think about why did things happen this way, Za was a pharmacist. And I think she knew exactly what was going on. And I think she chose not to talk about it. So the fact that she didn't, the most important thing to honor her was to not. I wasn't strong enough to realize that then. I was so frustrated that, we weren't going to be able to have this conversation that I thought really mattered. And in the end, we did not get her into hospice until 24 hours before she passed. And what a missed opportunity that is. She could have been propped up
Yeah.
outside in the sun with her beautiful little girl baby running around. So it was an overlap between those two things. And then an experience being a cashier at Walmart for 18 months.
I am so glad that you brought that up because I needed to ask you, how did that happen?
So when we sold, we lost Za and we founded this movement called Engage with Grace. We had sold Eliza in a way that technically was a fantastic success, as you alluded to. But for me personally, it was a bit of a heartbreak because it was like a child. And I think I had what can only be considered a midlife crisis. And I was traveling around. I was being paid to give all these big talks places about like the social determinants, about the unmentionables, about expanding the definition of health to include life, about all these things. And I felt as though, who am I to speak with authenticity about so many situations I've never experienced? Because I live in a freaking bubble.
Mm.
And so I thought, I need to get out of that bubble. And people were like, well, you could volunteer. I was like, that's not the same. They said, well, you could go work full time at a nonprofit. I said, that's not the same. I want to go be a cashier at Walmart. So did that at store 2660 in North Reading, had an absolutely transformative experience, crashing head into the most beautiful realization, which you already know and live, which is we are all way more alike than different. And
Yep.
every single human I worked with and who walked in my line was an extraordinary specimen in and of themselves. And the opportunity to see people on that front line, both the associates working at Walmart, but all the folks coming through a Walmart, helped kick us into the idea for Archangels, which is we have to expand not only the definition of health and what it is, but also where do we find people within it? And so started really rolling out Archangels, take one, in Walmart.
In Walmart, like you
Yeah.
started
So
giving out, like, how did it start in Walmart?
Yeah. So we, as a cashier, we got permission from our store manager and then ultimately worked with Walmart to try and expand this in a much broader way. And then COVID happened. The very first incarnation we now call them care cards, but it was like a tear off sheet as people would become. And on that tear off sheet, it says something beautiful about caregiving. And then it had a list of all the kind of resources that are available for free for anybody and where they could go to get them. And as people would come through my line, and I would figure out that they were in that role, I'd start having that conversation and they would often cry and say like, oh my God, I never even thought of myself that way. And I was like, well, you are, and you're beautiful. And thank you for what you're doing. And here's some stuff that can help. That progressed to, we actually started wearing wings. And so people would come up to us and say things like, did you just fall from heaven? Or how'd you earn those wings? And that would be the conversation starter that then gave us permission that they initiated to say, actually, we're doing a movement to support unpaid caregivers, the people who are doing it all for everyone else. And then folks would have that same reaction and then we would say, and thank you. And then they would be teary and say, no one's ever thanked me. And we'd be off into that same thing. Yeah. So ultimately, what Archangels created was a process to digitize that very human experience to make it one that is much more scalable and sustainable.
Yeah. And where you can collect the data to make an appeal for more support, right?
Yes. Please. Yes.
Exactly. So what are you doing with Archangels to appeal for more support for them? Because I know there's a whole lot of different resources just on the website where people can go to if they're dealing with stroke, for example, or other causes of needing to be a caregiver or different
Yeah.
ways they can be supported as a caregiver. But what are you doing these days on the back end to get more support for them?
Yeah. So the data is over 40% of adults are in this role. 70% are experiencing at least one mental health condition. That could be anxiety, it could be depression, it could be stress, it could be suicidal ideation. It could even be active suicidal ideation. And so I will verbally give a trigger warning because talking about suicidal ideation must always be done with enormous respect and care. If you take our nation and split it into 4 cohorts, 4 separate populations, and the first population is not doing any caregiving at all, 4.5% of that population has actively thought about suicide in the last 30 days. If you say, okay, well, what does it look like for someone who's caring for one or multiple under 18? It doubles to 9%. One or multiple over 18 or 18 or over, and it's 10%. I don't know if you know this data, but okay, what percent of that 23% of adults, close to 1 in 4 of us, are sandwich generation, panini generation? We're doing it both, probably multiple ages, right? So it was 4.5 to 9 to 10. What percent of the close to 1 in 4 of us who are in the sandwich generation role do you think have actively thought about suicide as of COVID in the last 30 days?
Goodness. Hopefully, it's not following this mathematical pattern at the rate of increase because that would be like 20%, wouldn't it?
It's actually 52%. It's 52%.
No.
Yeah. And which is horrifying. And it's also on some level for the individuals who are in the data that makes up that percentage, it can be incredibly calming
Mm,
because up until the moment they hear that data, they thought they were the only one.
right, and they thought they were an outlier and
They
not
thought they
that
were
they
an
were
outlier.
having a very common response to their
In
stimuli.
in fact, they're in the norm,
Mm,
right? At the broader step, they're over 50% of folks are feeling like they are. And what we'll find, and people will say to us over and over, and I was like, oh my God, just knowing I'm not the only one is helping to reduce my intensity. It
mm,
helps me feel like it's not that I'm failing at yet another thing. It's that I
mm,
have all this other stuff going on called being a caregiver. And that work is intense and it's beautiful and it's hard. And all of these things can be true. And that is a perfect, pathway to help somebody have that aha moment, feel the self-recognition, begin the process of giving themselves some grace, and then helping them get matched right over to these resources that exist already to support them. And then all of that kicks off data that lets us go back to a state legislator, lets us go back to a CFO, a CHRO, right? A health plan system to say, want to know the coolest thing ever? There's this population that's close to 1 in 2 of us that is undertaking enormous amounts of activity that, by the way, is saving you money, and they're not getting supported. And if we don't find a way to start supporting them, they won't be able to show up at their jobs. And the person they're caring for is going to have worse outcomes, and they might end up in the nursing home. And by the way, this person who's in the unpaid caregiver role, it impacts our relationships. It impacts our ability to show up for our partners, for our kids. And you're going to start seeing the ripple effects of that as well. And so you can sort of see the top and bottom line impact that can serve as a crushing blow. But what you and I really care about is let's get these souls feeling at least seen and at least more appreciative for what they're doing and at least more matched to things that are already existing to support them, while we use the data to mount a data-driven argument that more reinforcements need to be coming.
definitely. And that is something that I see a lot. I make phone calls to stroke survivors, and a lot of the time they're caregivers because a lot of people who have strokes have aphasia or they'll have cognitive or memory issues, and they'll need someone to step up and be the coordinator for their appointments, their medications, helping them with their what we call ADLs or their activities of daily living, which could be getting dressed, going to the bathroom, and having food made, which I mean, these are things that what if it's the stroke survivor who was the caregiver before, and now all those people they were doing everything for are the ones who have to take care of them? That's a huge role reversal. And a lot of those people, like, thankfully, a lot of them have an eldest daughter who is usually the one to step up and make
Mhm.
the binder that they keep everything together in. But I mean, a lot of the time they're having to scramble for and not even know what questions to ask, right?
Yeah.
And like you said, a lot of them don't identify as a caregiver until that term is kind of given to them.
Yeah.
They just think, oh, that's my mom, or that's my dad, or my
Well,
daughter, heaven forbid, when that happens too.
well, and the point you just made that is so, so important is, and the data is beginning to indicate this, the impact unpaid caregiving is having on our mental health. We went through that data, but on our
Mm,
physical health. 40% of people who are caring for somebody with Alzheimer's pass before the
mhm,
person that they're caring for. And I know a number of people who have had a heart attack and or had a stroke in the
mhm,
most intense times of
mhm.
them serving in one or multiple caregiving roles. So I think what you just said is so important to be listened to. So anyone who's listening, first and foremost, take a minute to understand that you are probably a caregiver in multiples. If you're a nurse, you're almost definitely a caregiver because the kind of person who goes into the role of being a nurse is disproportionately the one who everybody is calling. Everyone is coming to their house and they're voluntarily going
Outside of their work hours.
outside of their work, right? So we call those double duty caregivers. And
Mhm.
I have to make one other point. You brought up aphasia. I mean, there's so many things about stroke and the impact it has that really does vault a family from life has things that are hard and good days and bad days. But if you go from, the person that you love was healthy and well and self-sufficient to the person that you love had a stroke, the amount of destruction to the expected idea of how life is going to be and the understanding of what might go on is you don't know what's going to happen from a recovery perspective. And you mentioned aphasia. And I had brain surgery myself. And after my brain surgery, I was 9.5 hours to the center of my head. I had aphasia for about 4 weeks. And it is so hard. And thank goodness I had my man and my kids, my mom, my dad, my bonus dad. But I remember there was this one moment. I mean, there were a lot of obvious moments, but the dog wanted to go out and I could see the dog wanted to go out, but everyone was so focused on me. And I just kept going with this. And so my man finally turned and saw what I was looking at. He goes, "Oh, you want us to let Lulu out so she can go pee?" And I was like, I wanted to fall on the ground. It's just like little
Oh.
things, right? Not being able to articulate. And then you have those people around you who are just giving everything they have to help you get through that moment. And that's a lot. Caring for someone who's had a stroke is one of the most intense, the highest percent of folks who are in the red.
Yeah, and is happening more and more to people who are younger and younger. It's not just people who are in their 70s and 80s. It's actually in the top 10 leading causes of death for children or the pediatric population. But I mean, there's plenty of people who have strokes in their 30s to 50s as well. I
Yeah.
think you've known somebody in that age range, right?
I do. A gentleman who, I mean, to be clear, he was one of the most handsome, fit, gregarious rock stars of my high school experience. So I definitely remember him. But I've known him since, lives intertwine and you keep in touch, maybe not super closely, but you keep in touch. And I think it's probably about 8 months now, he's 53. I'm 54. He was in the grade below me, local still. And in such perfect health, Rosa, like if you were to say who you would never, ever, ever envision could have a stroke, this man made all the right decisions, not my Prosecco self-medicate decisions, for example. He he had a massive, massive stroke
Mm.
about 7 months ago. And he has a daughter who took the semester off from college to be home. He has an ex-wife who has dropped everything to come and support. He had a relationship that it's not clear whether that's going to survive. The circle of love from his best friends, his brother, who have absolutely altered everything about their life as they know it. And are they sad about that? No, because they love this guy and
Yeah.
he's recovering slowly,
Mhm.
but it is incredibly intense. It's intense for everybody involved. And I am so grateful. Thank you for reminding all of us. Again, we have a picture like, oh, a caregiver is like me for my mom. Yes. And someone who has a stroke is, you know, 85 and yes, and all of these definitions that we use quickly to reference or think about something in our head, we got to break them all wide open because with the demographics shifting the way that they are, the wealth divide increasing the way that it is, how caregiving is manifested, who's responsible for doing that caregiving, how health is manifesting, who's responsible for supporting people with their health, all bets are off in terms of what you used to think was true.
It's true. And I mean, maybe at some point we'll have some robots that can help. Honestly, like they want to talk about an AI nurse. Like, I'm like, only if it's going to be lifting those 500-pound patients. Bring in the robot with the AI that knows how to handle all this without breaking all of our backs, right?
Yes, yes.
So, like, are there any like technology evolutions that you're looking forward to seeing more high tech support for caregivers so they can keep their high touch experiences and reduce that intensity?
Yeah. I think the number one goal we have at Archangels is for the nation overall to recognize the high percentage of folks who are in this and to see that as an opportunity. Because
Mhm.
absolutely every single industry could use both technology and marketing and policy and advocacy to make a demonstrable short-term impact on the ability for these individuals to stay alive, to stay functioning, to stay married, to stay parenting. And part of it is just when you broaden that definition of what health is, let's use, you talk a lot about the financial impact of caregiving, right? Let's talk
Yeah.
about if I'm a caregiver for somebody who has Alzheimer's or dementia, is the bank making it easy for me to start helping my father not become the victim of financial fraud and abuse? No, it's making it almost so enraging. That's an example of I want to, tear my fingernails into my thighs. If a bank saw and did the math in their own head, we have all of these individuals who are our current customers, and many of them are getting on and they might have risks of cognitive impairment, and they have people who are caring for them. And we have that parent already as a customer. Wouldn't we want to keep that parent? And ultimately, the person who's going to make that decision is going to be probably that adult child. Wouldn't we want to start being nice to that adult child now? So, what if we actually figured out a way how to track who has a power of attorney and to actually respect a power of attorney? What if we found a way to help get the person who has a bank account start fostering conversations with family members about how they want to handle financial situations? I can tell you that after one particular situation in my head, we could not fire the bank fast enough. We couldn't tell enough people fast enough what this bank had done to be so hard on us as we were doing everything we could to care in this particular situation. And so, hey, financial institutions out there, whether it's technology, whether it's robotic technology that's driven by AI, or whether it's just kindness, what you have in your power to do, sensitivity in your written statements, whatever it is, start treating the unpaid caregiver, who is both a current customer and caring for your current customer, as the most delicious opportunity you have. And I'm going to say it again, to just suck less.
Right.
Ideally, start being awesome. But if that's not
But
possible right now,
but let's
just
at
be a little
least
bit less of a jerk to this population.
exactly. Like, you're so right, though, and it can be very simple. Like, I don't know how convoluted your situation got, but there we were opening a children's check or children's bank accounts for our children, and my husband had taken them to open the accounts initially, and I went over there to like add it on my driver's license and everything and make some deposits because they had earned some money and they wouldn't let me make the deposit. And they also wouldn't let us add a second parent onto the account. They said only one adult can be on the account with the children. And I was like, so you don't like it when children have married parents who trust each other with money? Like, what is the plan here? This is a bad plan. We closed that account.
Yes.
That was, they did also make me wait an hour before they figured out that that was the policy. It was ridiculous. But you're right. There are just so many logistical things that you could smooth out these processes. And like
So
you said,
that,
you would expect a bank to be able to do some math and figure
like,
this out.
and if the reason that they can't is because there's a federal regulatory policy. Okay, well, then revisit that policy and lead with that policy. Lead with saying to you, Rosa, we are so sorry. This is outside of our control. But here, sign this petition because we're trying to get this policy overruled because we understand the
Mm,
frustration it is
mm,
for a parent like you, right? Just address the situation.
right.
I'll call it another one. The number of denials or, changed prescriptions that you don't hear about until a Friday night. Let's take your example of someone who's caring for someone with a stroke. The
Hmm.
medication management on that alone could be like a full-time job for an unpaid caregiver.
Yeah.
And by the way, nobody is making it easier for that unpaid caregiver to get access to the information they need, to the help they need. They are on hold for hours. They are passed off to someone else who passes them off to someone else. That is real time. That is real mental exhaustion. And those are real dollars
Yeah.
that are being borne by the unpaid caregiver. Hey, employers, let's start paying attention to how many hours of a work day an unpaid caregiver is being forced to be on hold with a insert you know who. Employers, please start working together with us from an unpaid caregiver perspective to start reminding folks every barrier, every obstacle you put in front of an unpaid caregiver being able to do their job is ultimately going to be traceable back to a financial cost to you. I hope you employers, I hope you care for unpaid caregivers because you are kind and loving and virtuous. And I think that's true for many. For those of you for whom that doesn't turn you on, how about the fact that these unpaid caregivers, these are hours that they are being forced to be not productive. They want to be at work. They're being forced often to leave these jobs. Work is respite for an unpaid caregiver and they need the money.
For
So
sure.
this gets at what I know you look at all the time, which is what are community-based public-private partnership ways that we can take on these big, hairy, scary problems, one bite at a time to create these cross-sector collaborations, to create situations where it really is a win-win. Because with unpaid caregiving, if we do not address this, it's going to be a lose, 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 lose.
Exactly. And we really just can't afford it. So, I mean, sticking with stroke, because that is my lane, the strokes are have been increasing in incidence. I think we've had a little bit of a plateau with GLP-1s helping address obesity, high blood pressure, high cholesterol, diabetes. I mean, that really does actually prevent cardiovascular disease and stroke. So thank you for that. But it's not like it's going down across the world. So this is only increasing in that regard. And the longer we keep people alive, which thankfully we can keep people alive, the longer they're going to need caregiving.
Yes.
So this is not a need that's just gonna go away.
Well, and one of the things I think about a lot, I am a daughter of divorced parents, and my dad went on and had a second wife and then had a third wife. And my mom had my bonus dad, my second dad, and they stayed together and everything's great. My man, his situation is very different, but let's just say his situation mirrored mine. You
Mhm.
could very quickly end up in a situation where you have a couple who each have divorced parents, who each have remarried, who may have other children. And we know the incidents that can happen, right? Maybe there's been a mental health thing. Maybe there's been a substance use disorder thing. That the number of people we are increasingly becoming responsible for, whether we signed up for it or didn't, it's that tipping point we all talked about, but now we're living it. There are not going to be enough people to provide the care that is needed. So I love that you brought up, robotic care. First and foremost, we got to start having these conversations, get stuff
Yeah.
set up ahead of time about, hey, mom, hey, dad, what's our plan? Right? I didn't expect to have major brain surgery. That threw quite a ruckus in things. And I was 54. Well, we know that at some point we're all going to age. Have I put in place a plan yet to make sure that my kids are going to be okay? Yes, but that's because I've seen it happen. And I know you have, right?
Mm.
So everyone else listening, start now. Start when you're 30, 40, 50, 60. Have these conversations regular and often so that if there's a stroke that is unexpected, the family has a plan for who will kick in, offering what levels of expertise. You're aware of the resources that are around you to support. You're ready to step in. Because the last point I'll make on that is unpaid caregivers don't stand around waving their arms in the air saying, help me, I'm a caregiver.
They do not.
They don't. In fact,
They
if I
feel
said to
like
you,
it's a personal failing if they can't provide everything as their one self. But so many times, like one thing I talk to my children about, they're 9 and 16. So if people want to judge me for being morbid with my children, whatever, I tell them, I changed your diapers. One day you're going to need to change mine. And when they say, ew, I'm like, well, then you better earn a whole lot of money so you can pay somebody to do it right. And
man, sister, we have the
right.
exact same conversation in my house. Yes. Yes.
And, and then my daughter will be like, oh, well, I bet Bubba can do this stuff for you. And I was like, well, then you better make even more money because you guys got to be fair here. Balance it out. People have different strengths, right? I might need her to go be the attorney to go argue about some issue, right? We all have different strengths. Maybe one person can be the assisting with their daily living activities and the other one assisting managing the money and kind of
Yeah.
divvy it out like
Yeah.
that.
Someone else is
But you
handling
need cooperation.
transportation. Someone else
Mhm.
is handling medical, picking it up, billing.
Mhm.
One of the things you just brought up is something we think about all the time. When you had your beautiful 9 and 16-year-old, you probably appointed a godparent for each godmama, godfather. And, when you get hitched, you think hard about who you're going to ask to marry you and how you're going to ask. We think about how can I say now, and certainly as I'm getting older, if I'm facing some health risk, to the people in my life, will you be my archangel? Will you care for me when I'm older? Right? Why don't we turn that into a celebratory ritual of sort of formally saying, will you be my person? Because someone's going to have to be all of our people. And you might have
Mhm.
multiple. Why not make that something we do with intention so the person you're asking to play that role can feel the honor of that role and can themselves start working to put in place the support system, planning, and infrastructure that it is going to take in order to be able to do it?
It's so beautiful, and I love how you, like, lined it up like being a godparent. Will you be my archangel? That is so
Yeah.
oh,
So, Rosa, I'm in. I'll be your archangel. Yes.
well, not you, you're already overcommitted. I saw your precious daddy in that video
Yeah.
on
My
LinkedIn.
God, he's
My
so
goodness.
perfect. How perfect is he? And what was he doing in that video? He was caring for me, right?
Right? Saying he had his hand on your back across the ocean or something when you were out
Yes.
there changing the world.
Yeah. He's so beautiful. He's
So
so
sweet.
beautiful. We also say, we talked a little bit about when you get your score, which takes 2.5 minutes, it puts you in the clear, yellow, or red. If you're in the red, you need a red phone. And
Mm.
know who that red phone is and be someone else's red phone. I use my red phones. Sometimes I'll just call and say 60 seconds worth of swears because I don't have time to describe what's going on and they don't have the time to understand all the ins and outs, but they will receive my 60 seconds of swears and they will know when I hang up that I'm going to be able to go back to my job or back to that intense situation I'm in. And they received it and they can just know I'm in the red and they just help me reduce my intensity.
Mm.
They're the red phone. So be the red phone and have a red phone.
I I love that. I am gonna be sharing that with some select people pretty soon because that is a good plan. You know
Yeah.
what? This is the longest I've ever gone without asking my billion-dollar question, Alex. I could talk to you literally all day. So, I need to ask it before I forget, and then we can talk for however long we want. But, one thing that I ask everyone on the Nurse Rosa's Insights podcast is, if you were given a grant for $1 billion to meet a need you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
So, Rosa, I knew you were going to ask this question. And so I actually prepared.
Yes. Okay.
And it was so fun to sort of think this through. And what I originally said when the team said, this is the billion-dollar question you have to ask was like, I don't know how to answer that question because I'm a bootstrapper, right?
Right.
We buy intention, never raise money. And we think having too much money actually dulls the senses to be able to get the feedback when something's working or not working, because feedback that's something that's not working is really
Mhm.
valuable. So you can then go forward, learn from that, and do something that's better. So my first answer is, good Lord, please don't. I don't want $1 billion. However, because we have bootstrapped for so long on this topic, because we do have a ton of data driven, experientially informed expertise. I usually don't use the word expertise, but I'm going to use it because I love you and your face is so perfectly making me feel I can say whatever I want. What we would do is take that $1 billion and we would use it to shamelessly scale the platform so that absolutely every single one of those over 40% of adults who are in this role, 100 million Americans in this role, could get their score and could be matched to the resources that already exist, could have the language and use the language, could be seen by their employer. We always say we want the environment to be so lush with caregiver recognition and support that the unpaid caregiver doesn't even need to say a word, right? Like the environment sees them and is there for them. And in so doing, health systems, health plans, states, the government more broadly, rally around this massive opportunity to go ahead and turn that $1 billion into national impact, because it is the way to sustain, the economy in a way that could build a ton of value for everybody. And the reverse is also true, because if we do not make that investment, humans are in a really, 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 really bad spot. So I'm doubling down on, I have all the faith, whether the $1 billion happens or not. We are, because this opportunity will not be denied. Like, it's coming. Sometimes when the data flips and people just start living it, whether they ever thought they would or they weren't, they're going to. The data is saying there's no way we're going to avoid this. So why don't we get ahead of it and make it as beautiful
Right.
as it possibly can be?
Right. And I love that this kind of turned it on its head for you, because you were able to look at what you've already done and you built the infrastructure. You got the proof. The proof is in the pudding already. And you're
Exactly.
like, let's
Let's go.
just
LFG.
do more of what we're doing that is working.
You know what, Rosa? That is the perfect note on which to end. We say all the time, do I wish there were $1 billion grant coming? Heck yeah, sure, of course. Do I wish that somebody would come and pour money on unpaid caregivers? Yes. Until they do, there is still so much we can do just by
Exactly.
seeing this population, loving on them, and doing your part to match them in that moment to the stuff that already exists. That is well
Yes,
within every single one of our capabilities to do that starting right now.
definitely. Definitely. And if you ever want to talk about stroke resources, I'm your girl. You
Well,
let me know.
we definitely will. And I would love to pick your brain about that. And I'd love to make sure that we're building onto the Archangels site condition specific resources.
Hmm.
We know that the things that drive intensity and reduce that intensity, we call those buffers, are very universal across all caregivers. And then we know there's also very specific manifestations that will additionally be unique to someone who's caring for someone who's had a stroke, someone who's caring for someone who's had a seizure, who's going through cancer, right? So we really want to start increasing the depth and breadth by those conditions. And I think you and I should have that conversation as soon as we can.
Yeah, I love that idea. Well, so if someone is listening to this and wants to learn more about how they can support Archangels, we haven't even really talked about the care badge.
Yeah. How have we not talked about the care badge?
I know, right? Okay, tell us, what is the care badge?
So, and what we can do is package up so that you can have on both the link to get your score and find out if you're in the clear, yellow, or red. Also, get matched to those real-time resources. Also, to get your care badge. So you said it so perfectly, like 6 minutes ago, but I was overexcited about something else. You mentioned that people who are in this role are simultaneously a lawyer, a financial advisor, a consultant, an innovator, because unpaid caregivers have to solve the problem because no one else is going to, right? They're a negotiator. They're a hands-on clinician. They're a therapist. And all of those skills they are building as they are doing this role called being an unpaid caregiver, but not giving themselves credit for it.
Yeah.
And oftentimes someone might have had to leave a job in order to care for someone who's had a stroke.
A lot
And
of
they might say, a lot of times, and they might say, gosh, I'd love to get back into the workforce, but I have this gap on my resume of 5 years. In which case we can say back to them, that is not a gap. That was a job called being an unpaid caregiver. A beautiful job. You did the job, right? That job gave you skills. Put that proudly on your resume. Stick that on your LinkedIn. And so there's two places you can go to do that. The care badge, which gives you the most gorgeous visual. You have it, right? That shows the care that you have provided, and it helps you. Then you can go to archangels.work and it does a skill builder for you where it helps you
oh,
translate those tasks that you've been doing into the skills that employers are looking for. And I'll also add, in the world of AI reviewing everybody's resumes, it is important to fill those gaps, right? Because they
Mm.
are not a gap. That was work experience. So go to thecarebadge.com. It is free to anybody. And if you don't know how to quantify what those skills were, go to archangels.work at the same time, grab those skills from archangels.work, stick that care badge onto your resume, and you list those skills right next to it. And that way you can bypass the sort of plucking off that AI is doing of people who had an unexplained period of time they weren't working. Let me tell you, employers, not only were they working, they're exactly the people that you want to hire. We live in a care economy, and unpaid caregivers know how to care.
Right. And they know how to navigate the system. They learn by experience and
They
trial
have.
and error.
Yes.
They are the
Yes.
experienced people who can bring all of that wisdom from real world experience
Yes.
into the workplace without
Yes.
ideals of thinking things are going to be easy.
Yeah. Yeah. And
For
in a way that's so deeply respectful on both sides, right? Which I think is
love,
so key that you do so naturally.
love it so much. Awesome. So if people want to find that, you list it off on the website. If someone wanted to reach out to you, is LinkedIn the best way?
Yeah, come find me on LinkedIn. Absolutely. And everyone who's listening, thank you for listening and thank you for showering. Like, you can get or gift the care badge. I think we should all be gifting you care badges. And when you gift somebody a care badge, you can write a little note. And I'm sure there are people who are listening to you now and have listened to you before and will listen to you after, for whom the tips, tricks, and hacks and love and care you pour out on this podcast have made a life changing difference for them. Thank you for the way you show up. You are the penultimate caregiver. You are like the penultimate archangel. You really are.
I'd have to pass off some of that onto my husband because he makes it possible for me to do all this by being super daddy. But thank you so much. I appreciate you, Alex.
Yeah. Send him a care badge.
Maybe I will.
Yeah.
Maybe I will for, I mean, his birthday and Father's Day is coming up. We can
There it
add,
is.
that'd be good.
Yeah.
So, for all of our listeners, if you have learned something from this amazing conversation with Alexandra Drane, please feel free to leave a comment. And if you have additional questions, feel free to send those as well. You can find me on social media on all the different platforms at Nurse Rosa Speaks. And then I'm also on LinkedIn. Please like and subscribe to the podcast wherever you're listening through the Health Podcast Library or if you are watching on YouTube. And I will see you in the next episode.
Thank you.